Hello and welcome to Time with Lydia, the pharmacist. Today we are going to talk about a very interesting topic that affects a lot of women. We are going to explore 5 common symptoms of endometriosis that every woman needs to know. Endometriosis is quite common in women, and about 10% of women worldwide suffer from endometriosis, meaning about 176 million women worldwide suffer from endometriosis. Endometriosis is a condition that can be hidden in a woman for a long time before it is detected and diagnosed. Before we start talking about the 5 common symptoms of endometriosis, first of all, let's find out what endometriosis is. Endometriosis is a condition where cells similar to the ones that line the womb are found elsewhere, and most of the time these cells are found in organs that are located close to the womb, for example in the fallopian tubes or in the ovaries. The exact cause of endometriosis is not known, but experts believe that one of the main causes of endometriosis is genetics. The interesting thing is these tissues growing outside of the womb act and behave in the same way as the lining of the womb. So whilst the tissue in the lining of the womb is undergoing changes during the month as a result of hormonal changes, these tissues outside the womb are undergoing similar changes. In the normal woman, when pregnancy does not occur, the thickened lining of the womb is broken down and is shed as blood, which comes out of the body as menstrual blood. However, in endometriosis, these similar tissues that grow outside of the womb are also thickened, they break down and shed blood as well. But this blood that is shed is trapped in the body, and this can cause a lot of complications, including severe pain, inflammation, scarring tissues, and adhesions. One other interesting thing about endometriosis is that some women would not experience any symptoms at all, whilst other women would experience extreme symptoms. Now let's move on to the common symptoms of endometriosis that every woman needs to know of. So the first one is excessive or severe pain. And this is pain that can start way before your menstrual period, goes on during the period, and can even last some days after the period. There can also be severe pain during ovulation. You may also have lower back and stomach pain, as well as pain during and after sex. Some women may experience pain during urination or when passing urine, or pain when pooing or moving their bowels. The second common symptom that most women would experience when they're suffering from endometriosis is excessive bleeding. And with this, when you're having your menstrual period, you would realize that you would have to change your sanitary towel several times in the day. You would experience bleeding with clots or no clots, and sometimes you can experience prolonged bleeding. One other common thing associated with excessive bleeding is bleeding between periods and spotting during the month. Number 3 is bowel and bladder symptoms. Apart from the pain that you experience when passing urine or when moving your bowel, there can be bleeding from your bowel as well, and you would experience symptoms that are similar to that of irritable bowel syndrome. That is, you would have times when you suffer from diarrhea and times when you suffer from constipation. There can also be times when you suffer from nausea, bloating, and stomach pain. And these symptoms would normally occur before and or after a period. One other common symptom of endometriosis is infertility or having difficulty falling pregnant. And for some women, endometriosis is first detected when they are going through tests for fertility treatment. And finally, number 5 is fatigue. Because of all the changes that go on in the body, you would realize that you feel tired all the time, possibly due to excessive bleeding. Now, our take home for today: the fact that you are experiencing any of these symptoms does not mean that you are suffering from endometriosis. There are some common gynecological conditions in women that can cause similar symptoms. But the key here is, if you're experiencing any of these symptoms, for example, excessive bleeding, excessive pain when you're passing urine or moving your bowel, bleeding when you're moving your bowel, excessive pain in your stomach or lower back, your abdomen, it means that there is something abnormal going on and you would have to seek medical attention immediately. Please don't suffer in silence. Seek help. There is help available, and the earlier the condition is detected, the better the treatment outcome. I hope this video is beneficial. Please don't go without giving it a thumbs up. Share with your family and friends. If you haven't yet subscribed to this channel, please hit on the subscribe button and also on the notification bell so you don't miss any of our informative content. Leave your questions and your comments in the comment section. Thank you once again for your time today, and I hope to see you soon in the next one. Bye for now.